You're listening to The Sunday Show with Gary Robertson. We're going to turn our attention now to the situation in Venezuela, where rescue efforts are ongoing, following two back-to-back 7.2 and 7.5 earthquakes. Caracas and the nearby coastal city of La Guaira being the hardest hit. Seismologists have called it the biggest earthquake that Venezuela has seen in more than a century. The death toll currently stands at 1,430, with 3,238 injured. But that number of dead and injured rises by the hour. The UN estimates around 50,000 people are missing. Let's speak to Karol Bassim, who is with the International Medical Corps Emergency Response Unit and is on the ground in Venezuela. Karol, thank you very much for speaking to us. And what is the situation where you are at the moment?
Thank you so much. I mean, it's very hard to put into words what the past 4 days have felt like. When the earthquake hit on Wednesday, Wednesday was a holiday, and no one imagined how deeply it would scar communities. And now standing here, what strikes you most is the expression of people's faces. It's mixed of disbelief, fear, exhaustion, and heartbreak. When we walk through the affected communities, the first thing that hits you is that the stillness. It's as if like the world has stopped. People are gathered beside the ruins of what used to be their homes. Many of them are still in shock, sitting on pieces of rubble because they have nowhere else to go. And families are holding into a little bit of hope while waiting for any sign or any news about their loved ones who are still unaccounted for. So even days have passed, the grief feels as if it's raw, as if first night, and the uncertainty is overwhelming. There are still people trapped. Rescue workers are doing everything they can, but the conditions are incredibly difficult, and time is working against everyone. Suffering is visible in every corner, and communities are trying to support one another, but they're exhausted. This is a major humanitarian emergency, and it requires immediate support. People can't wait for days for help. They need medical care. They need safe place to stay. They need clean water. They need food. The local responders are trying their best, but to work under extremely difficult conditions.
And when it comes to trying to rescue people who may still be trapped under the rubble, what is your sense of the operation that is underway? And has the government responded adequately? Are teams on the ground? Are mechanical diggers being moved in? What is actually happening?
I mean, as you can see, the destruction is severe, and many buildings have collapsed, and many other buildings are still standing but have deep structural cracks and may no longer be safe. Rescue capacity is overstretched, and in many places, family themselves have been trying to take people out using basic tools, and sometimes even with their bare hands. It's a very challenging situation.
And as regards, as you say, the humanitarian crisis that's unfolding, is aid beginning to arrive from other parts of the world?
Yes, yes, and everyone is trying to do their best to support the communities. I know the some of the roads are blocked, and it makes it a little bit difficult. But from our end, we have deployed already an emergency medical team to the affected area, which is one of the hardest hit region in La Guaira, and which includes Catia La Mar. Around 70 to 80% of buildings there are damaged, and hospitals are overwhelmed, and they're running out of medicine, supplies, and even basic essential clean services like clean water or food.
And what are people doing? Where are they going if they can't go back to their homes, for instance, because it's structurally unsound?
Majority are staying outside the area, like near the area of where their home have been collapsed, so they have nowhere to go.
And are you seeing aftershocks as well? Are there concerns about those buildings that have been damaged that we may see further collapses?
Well, definitely we've seen several aftershocks, and it's a little bit concerning because, as I've mentioned, like there are several cracks on other buildings, and maybe they have not yet collapsed, but those aftershocks are real danger there. Those others that are still standing, but they have deep structural cracks, and definitely they're not longer safe. And each and every aftershock causes like a real fear for the whole community. And
Some
we've been facing a lot of aftershocks.
some parts of the world obviously are more prepared than others for earthquakes. This is the largest in Venezuela in more than a century, perhaps a country that hasn't had a lot of experience in dealing with this. What were the preparations like? Were there many in place for such an eventuality?
I mean, an earthquake can hit any country and it could be really severe. Definitely, the health system is the most affected. There's been a weak health system and economic crisis. But however, you can see around that healthcare workers and community members are all trying to do their best to support. We've been trying our best. As I mentioned, we've delivered we're delivering medical supplies and essential medicines so hospitals can keep functioning. We're bringing clean water because many facilities have none, and this creates immediate risk for both patient and staff.
I think we
In
may.
parallel, we have like other supplies that are coming that we are preparing to deploy. So we're coordinating with the national authorities, with the Ministry of Health, to ensure that we meet the immense needs.
Well, Karol, thank you so much for sharing your time with us this morning to tell us about that, and we wish you well in your endeavours. Karol Bassim there from the International Medical Corps Emergency Response Unit speaking to us from Venezuela.